be remiss if I did not bring up COVID-19. And I'm sure a lot of patients are curious whether the vaccine is safe and effective.
So we do believe the vaccine is safe and effective for patients living with lung cancer, and really important. And really important to be protected as much as possible. I was part of a group of other physicians around the world looking at the impact of COVID-19 on patients living with lung cancer. And we collaborated with a group of physicians. Marina Garcino was the lead. She was living in Italy, in northern Italy at the time of the first wave. And so was really face to face with it early on when there was so much we didn't know. And she gathered a group of us to watch and see. And what we were able to figure out before the vaccine was available was that people living with lung cancer who were overall healthy still, except for their cancer, were perhaps on the pill-targeted therapy or immune therapy, seemed to really not have that different of an impact compared to people who didn't have lung cancer. Chemotherapy was a little bit harder to tease out, but didn't seem to be such a big issue. It's different than people living with, say, leukemias or lymphomas, where the treatments are impacting their immune systems even more. They seem to have worse outcomes. A lot of lung cancer patients were okay, but still it's a higher risk. And so we want to protect our patients as much as possible. So we are, now that we have the vaccines, strongly advocating vaccines for any patient who is living with cancer, and really for almost anybody, because as physician really think that makes a big impact. We have not seen any negative impacts of the vaccine on any aspect of cancer treatment. It does not have a negative impact on how well the cancer is treated by the therapies. We did notice that when someone gets a vaccine, they can get some enlargement of lymph nodes. That's part of having an immune response, is your lymph nodes get enlarged. And so we did get a bunch of scans as the vaccines came out showing, well, this person has some lymph nodes in their the axilla, which is the armpit, and we would, and seemed to be correlating with the side that someone had a vaccine. And then those got away. This was actually an interesting medical literature thing, because for people getting screened with mammograms for breast cancer, there were suddenly all these lymph nodes showing up. But that was actually a sign that the person was responding to the vaccine. It went away over time, and it was a fine thing. It was just I remember the first patient I had where that happened, we're like, oh, well, that makes sense. Okay. So it's okay. So it was not cancer. It was just the immune response. But yeah. So we are recommending vaccines. We think, there's no data showing it is not working for lung cancer patients. The vaccines are less effective in people getting certain types of cancer treatment that are really suppressing the immune system. But even some responses better than none. And then we're still recommending the patients really do their best to stay safe with masks and things like that.